I'm speaking with Dr. Tousignant, who has recently published an article in Rural and Remote Health titled State of the Eye Health System in the Pacific. Is medical technology still available and used by mid-level eye care workers? Welcome, Dr. Tousignant.
Thank you. Hello.
So I was wondering if you could tell us a little bit to start off with about how the research came about.
Yeah, well, so this project came about a couple of years ago when we wanted to get an understanding of how what the impact was about training eye care workers in the Pacific and in Papua New Guinea. There's quite a need to be increasing the number of eye health workers in order to strengthen the eye care system. And so medical technology is a building block of these of the eye care system. And so we wanted to know if these newly trained eye nurses were accessing the medical technology that's needed for them to be able to do their job efficiently.
Right. And I wonder if you could introduce your research team.
Yes, so it's a group comprised of people from the Fred Hollows Foundation of New Zealand, who supports a lot of the training going on in the Pacific. We have an ophthalmologist as well, Dr. Sikivu from Fiji, who's very active in eye care in the Pacific, as well as 3 North American optometrists who have all worked in the Pacific in training eye care doctors and nurses.
Terrific. And what were the main findings of your study?
So we're actually finding that basically the big needs in terms of eye care in the Pacific have to do with people needing glasses to be able to see better, so uncorrected refractive error. And so the equipment that's needed for refraction is actually quite available to most of the nurses, which is really good news. We also surveyed them on their comfort using a lot of this equipment. So we surveyed them on whether or not the equipment is available and also whether or not they're comfortable using it. So for refraction or for uncorrected refractive error, things are good. The equipment seems to be available, and the workers seem to be confident in using them. The other big aspect is assessing the ocular health of the patients in order for them to detect any conditions like cataracts and other conditions of the front part of the eye. And so the equipment for that also seems to be pretty available. We're talking about slit lamps and loops. Slit lamps are pretty complex instruments to maintain and to obtain. And so some efforts have been done in the recent years to procure them to a lot of these eye nurses. And their level of comfort with that is also good. Their comfort with low-tech devices such as torches or loops in order to replace the slit lamps when they're not available, because a lot of these eye nurses will be going around in field trips and so on, is also basically they're very available, and they're also comfortable using them. So that's also good news. The last thing we looked at is the availability of medications for them to treat some of the conditions that they're finding. And well, medication procurement is always a challenge in many low research settings. They do actually have pretty good availability of antibiotics, but other medications are a bit more difficult in many areas.
So what are the implications for eye health in PNG?
So I guess what this shows us is that because in a lot of countries, in a lot of low resource settings, eye care is done with is mainly done by a handful of ophthalmologists. We're seeing now that in these countries where we have a mid-level eye care worker strata that's been developing, they're actually equipped to tackle a good part of the burden of disease. However, it does highlight also some skills in some areas for continuing professional development. Some of the techniques for more advanced refractions or more advanced eye disease identification need to be maintained or upskilled. So it also, noting these challenges also helps to orient what continuing professional development can look like for these eye nurses.
And what comes next for your research in this area?
That's a good question. We've got some more data we'd like to look at. We want to see one of the things we're looking towards is to see how much of their knowledge that they acquire during the training is actually retained over time and transferred into their workplace. We're also thinking of looking at how many of these eye nurses or these trained eye nurses are actually still working in eye care, and how is their role evolving over time after they reintegrate the eye care system.
Fantastic. Well, I can't wait to see what happens next. And thank you very much for speaking with us today, and congratulations on your paper.
Thanks very much.
Thank you.